I know that you're really busy. To everyone watching, this is Dr Valeed Ghafoor. Welcome to our channel in our latest episode of Q&A with the Doctor. Valeed, I want to do you justice here. You are a GP partner, a trainer, a dermoscopist, a GP specialist in emergency, acute and general medicine. Have I missed anything off the list there?
there's plenty more I've done, and I do, but they're just titles, aren't they? I don't think that's major. I've done loads of other stuff. I've worked in sexual health. I've done forensic psychiatry. Got a diploma in obs and gynae, so I've done that for a little bit. What else? I'm doing joint injections at the moment, so that's something I'm upskilling in. Joint injections.
Oh, joints.
So starting to explore the sort of avenue of, besides dermoscopists, like, becoming an actual dermatology expert. So trying to develop a little niche into that. Basically, I do something and then I think, what should I do next? That's sort of like the general trend.
Always learning.
Yeah.
So these achievements are amazing. Who I know you as, we go way back, is Dr Valeed Ghafoor, Foundation Doctor, 2015. And you joined, we were Pulse back then, but obviously what's any agency now, you joined us for locum work. So I think if we start chronologically at the start of the story, if you cast your mind back to 2015, what was your situation then and why did you decide to join a locum agency?
Yeah, so this is really strange to explain, because I'm guessing this situation will not apply to most people, but basically I was waiting to become an F2 so I could start locuming. So it's so unusual to say that. But I was having to locum internally as an F1. So as an F1, you can locum, but just not for an agency.
Because of the GC specialist provisional registration, yeah.
So like your trust will let you locum for them, and obviously you've got no other choice. So they, like, deliberately will underpay you. I mean, I'm sure they wouldn't sell it like that, but it feels like they deliberately underpay you, because what other choice do you have? You can't go work for anyone else. So I think I had done. So I put it this way, like nearly every single evening I was doing like 5 hours of locum work on top of my normal job and not seeing very much for it. But I didn't mind, because I was just upskilling at such a rapid rate. And I had 2 medical jobs in FY1. So by the time I finished FY1, I was probably more confident than most SHOs, because I'd done 8 months of formal medicine and then I'd done the whole year locuming in medicine. So I was clerking, doing ward cover, all the rest of it. So when I became an F2, the first thing was, all right, so where can I go locum now? And let's be honest, I needed to make some money. So I feel like we're not allowed to talk about money these days, but in reality, I come from a very humble background and I needed money at the time. So I joined agencies, and Pulse, if I remember rightly, used to give me shifts. So I was based in Preston, and Pulse used to give me shifts near my parents' house. So it was around the Rochdale sort of area. And it used to then give me an excuse to go and work and go see my family. So it just worked out perfectly for that reason. And I remember so many different hospitals I worked in, across the country, actually. I remember I went as far as Grimsby.
East as well, I think. Up to Northumbria. I think I remember you going up there. Tameside a few times, Manchester way. You did a lot near Rochdale, North Manchester, Greater Manchester, but I'm sure sometimes you went up to like Northumbria way and quite far.
And like I remember, I think there was like North Tyneside, and they would like give you a place to stay in. And this, I can't remember if this was with A&E agency or with someone else, but like I've even been to like Grimsby, I've been to Cardiff, I've been to like Wolverhampton. Like I used to do some absolute treks.
What do you think? So I know you said obviously the money of locuming was one of your incentives, and the other was to gain experience. So what do you think was the bigger benefit of doing this? Is it exposure to all these different departments, these different people, or was it that you're able to rack up some savings in your spare time for whatever you were saving and needed the money?
So there's the general stuff, and then there's the personal stuff. So generally, locuming gives you financial freedom. So it allows you to do things you might not otherwise be able to do. And this is something that's difficult. I think, for people outside of medicine to sometimes understand, because medicine is 2 years college, 5 or 6 years in university, then you do 2 years of foundation, and none of that is optional. That's all in stone, mandated, no breaks allowed. And if you add a break to your medical degree, it normally just means you're studying for a year longer to do an MRes or something. So when you get to the end, you've not had a choice for so long. So to be able to take some breaks and do some locum work, and a lot of people I know just take locum years, like as in after F2, they just take a year, 2 years, 3 years, and they just locum. And it gives them that flexibility to travel the country, maybe they travel the world, maybe they work and they do a diploma they've always wanted to do, maybe they open a business, maybe they buy property, you know, like you basically do whatever you want. I know girls that have locumed and then done like an aesthetics course and then they've opened up like a clinic. I know guys that are property minded and they put deposits down on houses. I know people that have just locumed the bare minimum and then just really enjoyed the year and just, you know, gone to the gym and spent time with family and traveled. So it varies.
So
Yeah, for me personally, I was convinced I wanted to be a medic. So by medic, obviously, I mean like a hospital specialist. So locuming was the opportunity to sample different trusts.
yeah.
So that's why I would deliberately travel to almost try and learn new things. Like I remember, and I don't want this to get overly technical, but like I had never seen a Seng-Stacken tube, which is like a tube used to stop bleeding from the esophagus. It's like a medical emergency. So I had never seen that until I traveled northeast, and there was just higher rates of like alcohol misuse, and there was like more likelihood of upper GI bleeding. And I saw one being used as an FY2, and I never saw one since. I've never seen one since. So like that exposure to that procedure happened on a locum shift. Or like, you know, I went on an ultrasound course, and the actual times that I got to use ultrasound to take blood was always on a locum shift. Because
That's so unusual.
yeah, no, but that's actually the reality of it, because you tend to locum where they need staff.
Yeah.
So you tend to end up doing stuff that you don't not normally needed to do. Like if I'm in a job and if I'm on a rota and a locum isn't required, the chances are the staffing is such that I'm not going to be the one that has to step up and do something. They're going to go and call someone that can do that. Whereas I would end up in a hospital and there'd be like no other doctor around, or sometimes you were like the sole doctor for that hospital overnight. And so it's just you, as in, if you don't do it, who else is going to do it? So you kind of have to step up and do things and learn. And these are safe things. These are things that you are taught to do.
Yeah.
But just because there's always someone else around, you never needed to do it. And as a
confidence when you push to do it,
yeah.
and you do it, then you got the confidence, like, you know what, I've actually done that. It's not just the theory of it. I've done the practical version of it now.
So like as an F2, usually when you do something, you're going to have a medical registrar turn up to an arrest. You're going to have like a anesthetic registrar. You might have a ITU nurse. You might have a resus officer. You know, you might have all these different people. But then I remember, like, if you go and do a shift at a hospital with no A&E department, there's probably not an anaesthetist around because there's probably no intensive care unit. So it can be just you. And I'm not saying that to put people off. Like, they were my best experiences in terms of like being asked to come and see someone and just having to know what to do and just realizing, is this person truly sick enough for me to have to send them somewhere, or can I manage this? Should I come back to them in an hour? Should I, you know, like just that level of heightened medical care that you deliver because you have to. I feel like just gave me such a passion for the field, and actually it was a positive reinforcement because I would start off thinking, how am I going to deal with this? And then I would deal with it, and then I would get better and the patients would get treated. So no harm ever came of this. Otherwise, obviously, I'd maybe reconsider. So I just kept getting better and I just kept learning. And then I would turn up for shifts and people would just sort of look at me and say, oh, are you the medical reg? And I'd say, no. Yes. So by the end of FY2, because I had another medical job in FY2. So by the end of
a lot of exposure.
Yeah, so I had a full 12 months of pure medical exposure just in foundation training. And now I'd had 2 years of ad hoc locum experience on top of that, which I'd done alongside my training. So by the time I finished F2, people used to like think I was the medical reg when I turn up somewhere. Just because I was able to do ultrasound, I was able to do lumbar punctures, I was able to put in central lines, and that's not stuff an F2 can normally do. And it's just because
the opportunity to do it.
Yeah, like at no point as a F2 would I normally put in a lumbar puncture, but when you turn up to a place and somebody needs it and there's not very many other people around, it becomes your job to do it. So, and that just was incredible. And then it progressed from there, really. And then I've worked in medicine till today. I mean, I'm a GP now, and a lot's happened in between, but I still work in medicine now.
So I remember the sad day that you stopped locuming with us, which it's kind of sad because obviously you'd left us to pursue your career, but delighted because you got your GP training. Did you always want to do GP training? Was it your first choice? I think some people don't always get it straight away, but you were fortunate enough to get what you wanted to do first time. Do you think that was because of all the experience you've had, or you've just achieved so much since then? Is this exactly what you wanted to do and where you wanted to go?
So it's really difficult. I had so much exposure to such high level medicine so early on that I feel like I realized things that people sometimes don't realize until they're much further in their medical career. So I saw a lot of frustrations in medicine. I'm talking about career decisions, not like the day-to-day job, where, you know, I sometimes felt like a bed manager would overrule a sensible clinical decision because there was a bed pressure problem. And I didn't like that. I didn't like the fact that I could write something in the notes for safety and somebody somewhere that isn't clinical would override that decision. A big factor of my decision to go into GP training, I have to be honest, there was two things. One is I absolutely loved my GP job in FY2. And having all that medical experience just meant that I was doing such a good job of managing the patients in primary care. And my trainer at the time said to me, he said, it's great to be a hospital specialist and you will deal with the super complex 1% of the population, but would you not rather bring that knowledge to primary care and prevent the 99% needing that 1%?
Some way to look at it as well.
And he said to me, like all these patients we send off to headache clinic and these patients we send off to a kidney clinic, like you've done those specialties. You can manage those patients here and we can look after them. They don't need to have transport organized and then go sit in a waiting room to see a consultant for 5 minutes. Like we can fix all that. You have the knowledge, you could do that here. And I have to be honest, the junior doctor contract changed in 2016. So, and that was the time I was applying for specialties. So the junior doctor contract, in my opinion, changed for the worse. And it really put me off hospital training. And I then thought, well, hospital training isn't what it used to be because it changed the social hours and everything else and the pay grades had changed and all the rest of it. And I thought to myself, I love this now. Would I love this when I'm 40? I don't know. Because I probably, in all honesty, I probably burnt myself out a little bit. Because I wasn't just locuming and doing FY2, I was also presenting internationally, and then I was doing research, and then I was writing papers, and I was studying for exams, and I kind of, my week was averaging like 105 hours a week, and it wasn't sustainable. And I was thinking, I'm not even in medical training yet. What is this going to be like if I want to be a registrar? In reality, it's nothing like that because my friends did far less and they've been absolutely fine. So, but at the time, obviously, I didn't know that, and I just thought, well, I'm doing this. Everybody must be doing this, and obviously, people generally.
So I know
don't.
what you do now, but if you could just, there's a lot, but if you could just briefly kind of summarize to everyone what it is that you do, because I don't really know anyone that has this sort of combination that you have between GP and like acute. So if you could just briefly summarize it for us so I don't butcher it by doing it wrong.
So I'm conscious people are going to think I'm nuts when I say this. So I'm a partner, obviously. I'm a partner and I'm a 10-session partner. So I work Monday to Friday. in general practice, which is unusual these days. You know, most GPs don't like the idea of working 10 days. So I work 10 days. I'm a trainer. So I train foundation doctors, medical students, GP trainees, and now GP registrars. So I'm fully accredited as a GP trainer nationally. We're a big teaching practice. We're a huge practice, and we've got lots of people to supervise. So that's great. On the side, the things I do, I'm almost feeling weird saying it, like thinking about how nuts this is going to sound. So I worked as a medical SHO for a long time, and then I got offered a medical reg job at Northern Carolines, so up in Pennine, where my parents were. And after working for them as a medical reg for like 4 years, so we're talking, you know, all of GP training, I worked as a medical reg.
Like, do you mean
Yeah.
as part of it or in addition?
In addition.
Yeah.
So I was a bit nuts. Like I'd take like 2 weeks off for Christmas and then do like a 2-week stint as like a medical reg. So and then I'd do weekends and all sorts. And if I had like a week off, I'd do a shift, a set of nights. So interestingly, they asked me to be their medical reg. I used to work as an SHO, and they were like, "You're clearly at reg level. You know, just work as a reg." So when I became a GP, I worked in like this middle grade, this sort of odd position as like an associate specialist almost, but I didn't like it. I said, well, I've got a CCT. So, you know, in some parts of the world, a GP is a consultant. Like, you know, you're a consultant in family medicine in a lot of the world. So why am I working as an associate specialist? Because I didn't feel like it reflected my skill set. So about in January, they promoted me to a GP specialist in it's really odd. So it's in emergency and acute medicine. So emergency like A&E and acute medicine, which is like acute and general are like interchangeable. So essentially I'm a GP that can do A&E, that can do the MAU, like the acute medical stuff, and then can do like the ward rounds on the rehab ward and on like the dementia ward and all the other general wards as well. So I'm like I think they put me there thinking this guy can do all of this. So like wherever there's a shortage, like I can go and fill that gap. So I've been doing that since January now. So, you know, it's been going on a while. And then I've got a private role that I do in telemedicine. There's a big American company called Teladoc. So I do some work for them. I've worked for some of its competitors in the past. I also work in a private health centre in Manchester. So that's like fully private. Sometimes I do that on the weekends. And what else do I do? So I have worked as a specialist in sexual health and HIV. I have done some forensic psychiatry and normal psychiatry. And I am currently in the process of setting up 2 businesses. One of them is up and running and one of them is in development. So the up and running one is providing admin support to practices. So that's basically just where practices that are struggling, maybe their doctors aren't getting through admin, maybe they don't want to do admin, maybe there's too much admin, maybe there's too much sickness, whatever it is. So, you know, that's dealing with their lab results, their med requests, their tasks, their docman, whatever their need is, personalizing it to the practice, working in a way that suits them. What I've learned is no practice works in the same way. So they all have I've actually got like a crib sheet for every single practice. So just to remind me how they like certain things to be done. So I do that, that's up and running and that's keeping me busy in the evenings. And then the thing I'm setting up is a tutoring company to help people get into medical school. Because I spent 10 years for the University of Manchester helping them more or less for free, really. Just helping students get in and giving them personal statement advice and UCAS advice and interview advice. And then I thought, I've done it for so long, it'd be nice to actually make a company and do it formally. And obviously the whole intent is to make it sort of very accessible for those from like underprivileged backgrounds and people that want like generic advice, like offer very affordable advice en masse. And then if somebody wants more bespoke one-to-one personal tutoring, that's at their discretion. That's absolutely fine. I don't know if I'm allowed to mention the company on here.
Your own company?
Yeah.
Yeah, you get, well, so I have my network on LinkedIn is medical students through to consultants, and I've even recently, especially around results, I've seen medical students saying like, oh, my goal is to work in surgery, does anyone know like a mentor I can work in, all this and that, and I just don't really know anyone that does it, or everyone's so busy, like I wouldn't want to be like, oh, I know 45 surgeons, here's the detail, like I would never do that. So if that's something, you know, I'd be happy to share it under this video if you've got your name and if you want to, but you don't want to be, I'm just conscious you're doing so much, like how are you gonna have the time?
It might not even be massively relevant to them because this is to get people into medical school. So this is like,
So like college
this is college, yeah.
applicants.
So
Still, it's the power of LinkedIn is how we both got back in touch
yeah,
after
yeah,
all these
true.
years. So it's just
So
anyone might see it. You're welcome to say it. It's
I'll tell you the website name. So it's just it's www.thefuturemedic.com.
yeah.
So we've got a website up and running. There's final tweaks being done on it. We're not started heavily advertising it yet. That's a project in development. And the long-term goal really is to branch that into medical school. So then we start giving advice to people that don't know what they need to know to get into the relevant specialties further down the line. Like I didn't know what I would have needed to have done to become a medical reg in the specialty I want. So we want to cover that market, and then eventually we'd want to go into the postgraduate market. Like I've got like a 10-year plan of like what I want that to do in the future. For now, it's a passion and it's something I love, and it's just something I'm trying to get started. And purely just from a satisfaction perspective, like it's just something I've done for so long, and it's a field I know so well, that I just thought it wouldn't make sense to not do it formally.
I love how warmly you speak of it all, especially because in the media and stuff like that, especially GP is just constantly getting the same narrative, the negative press, the working hours, like it's just quite negative. So what advice would you have to any foundation doctors that might be thinking they want to go into GP or even acute medicine if they're feeling a little bit disheartened about the prospect of what the future of that specialty holds?
Oh, this is a really difficult question. And the reason I say that is I have FY doctors that I supervise now, and we have these chats. Ooh. I mean, I've supported an FY doctor recently that was going over to Australia.
Oh wow.
So he's already given up in some ways.
I'm like, oh wow for him, and I'm like, oh hang on, that means he's not here.
Yeah, exactly. So he'd given up, but there's so many. It depends on you as a person, right? I would say if you know why you've come into a profession, what difference does it make? Right? So for example, if you know you're in this to care for people, which is what people claim, that's what you said when you went for your medical school interview. You said, I'm doing this because I want to care for people. Then what's changed? Do you not want to care for people anymore? Like that's still the job, isn't it? That's still the job. You might get less thank yous, and you might get less cards, and you might get less flowers and all the rest of it. But that's what you said you signed up for. That's the way I see it. And for me, it was always the case of I just find people fascinating. I just find the process of what people do and then what diseases they have and how I can make an impact on that disease. That isn't changing. People are getting older, they're living longer. There are more diseases being discovered. There are more tests being discovered. There are more treatments being discovered. You know, there was a time where one person could probably do 90% of medicine. And now you've got so many specialties, and you've got so many subspecialties, and you've got so many divisions within a specialty. Like it's just getting more and more specialized because there's more and more known. So how can that not be interesting?
Exciting opportunity to keep learning and discovering more and being part of that.
And if you were genuine, and if you genuinely looked forward to a life full of learning, which is what we all say in our interviews, then you should be really excited.
I
Because you've
think
got
that's nice. I think that's a really nice summary because if that is the why, I think that's in any career. If you know your why, then it should always be the core thing driving you.
yeah.
The last thing that I was going to ask you, but I think you covered it quite well at the start, is I was going to say, do you think there is still any benefits of working with locum agencies? And I don't mean just Pulse, which is now A&E agency, and obviously you've recently got in touch with our GP World, which is another branch of our division, and then we've got pathology group, general medicine group, permanent division. Like, we have a lot of ways to support people. Do you think, and I think I know the answer based off your story, do you think there's value in working with a locum agency in terms of career progression?
Yeah, 100%. I would challenge someone to ask what the downsides are, realistically. So as an FY2 who wanted to locum, realistically, outside of the trust I worked for, how would I have known where else I could work? It's not that it's impossible, but in practicality, there's a lot that goes into it. You know, you would need to know where the hospitals are. You would need to know how to book shifts, what to do. You'd need to be able to actually not argue, but you need to be able to stand your ground. You need to not be a pushover. You need to have things legally confirmed. Then there's loads of mandatory training. There's all sorts of things.
Clients.
Yeah, like there's so much stuff. And with an agency, you don't need to do any of that. You just talk to the person at the agency and you say, look, this is what I'm looking for. This is the kind of work I like to do. This is the sort of work I absolutely will not do. For whatever reason, I'm not happy, I'm ethically against it. Whatever the reason is that's irrelevant. And this is the timing, these are the days, and this is the pay that I'm willing to accept. And then you go about your life and this person finds you that role. Like if that person didn't find you that role, you would have to find that role. And that would be less TV time, that'd be less gym time, that'd be less family time, that'd be less friend time, that'd be more time making your own legal contracts, that'd be more time understanding T's and C's. And for what?
Yeah.
Like what extra thing did you gain at the end of that? And you know, rather than having to ring a rota coordinator because you feel massively unwell, you ring your agency and you say, you know, I'm really unwell, and it creates that extra barrier, which means you have more protection. Because, like, for example, as an agency, there'll be certain clauses, you know, like if our person is sick, we'll give you this much notice or whatever. And if you ring a rota coordinator, they might say to you, well, yeah, you're sick, but you know, we're short, can you come in anyway?
Now you kind of have that emotional conversation where
Yeah.
you might feel a bit guilty to come in, but yeah, we're on agencies are on all the frameworks and it's all governed, all the laws. So I have to say though, I mean, I don't really look after that many doctors anymore, and you are a dream to work with. It's nice to have someone who knows exactly what they want, a true passion for it, just someone who really does want it. It was a real pleasure to work with you, and I was glad that I got to be your recruiter for that time, and to hear your story now is really rewarding for me as well. When you dropped me that message on LinkedIn, I was so excited to ring you and just hear where you ended up, and it's just really nice to see how successful you've become, how you're giving back not just to patients but to other doctors and even students as young as A-level students now, helping the future of medicine, really. So I just want to say thank you for your time this evening. I know you got so much on. Thank you for sharing your story. Thank you for working with us and working with me. It's just a real pleasure.
Honestly, Emma, like I'm not kidding when I say the pleasure's all mine. Honestly, like literally, and I messaged you this before as well, and I was literally thinking, I was like, oh, my partner now and this and that, and, you know, I'm doing really well and all the rest of it. And I was remembering being an F2, wondering whether I would have the money to attend a function, or whether I would be able to buy a car, or whether I'd be able to go and present at a conference. And I remember thinking, I've got so much I want to do, and I'm just so limited by money. You know, I didn't come from a family where anybody could really help me. And I remember thinking the only thing I can do is I can work. And I'd ring you and you'd sort something out. And I know like this isn't like why people do stuff, but I literally sometimes think, I don't think I would have got to where I've got to if I didn't have that background knowledge and experience, which I had because so many times you looked after me and sorted things out and got me shifts. And that's why I messaged you, because I'm not actively, like, you know, necessarily working through agencies at the moment because I've got so much full-time work. But it was that understanding that Pulse, which is now A&E agency, was such a big part of my life, and it was such a big part of my development and my growth as a professional. And I feel like that had a huge role in getting me to where I was. And central to that was you, which is why I messaged you to be like, thank you. I really appreciate it. I think you're incredible. I'm really happy for you as well for what you're doing now.
Yeah, I mean, I think we've both come a long way. I'm really, really happy as well. But is it strange walking the halls at the hospitals where you used to be a locum and you're now the GP specialist?
Yeah, it's really odd actually, because I've worked with nurses that have I've worked with nurses that have been in training who are now like the ward sister. So, and I've worked with people that have been a healthcare assistant and then they've decided to go and retrain and become a nurse. Or I've worked with like certain nurses, I've worked with them for like, 7, 8, 9 years. And like I just know them so well, they know me so well. And I've got like a real bond with them. Do you know what I mean? And can't explain that. I can't explain being the SHO, then being the reg, then doing like a ward round, and then discharging and making plans and running a unit. It's hard to explain. It's amazing.
That's everything. Thank you so much.